everyone. Welcome to week 6. This week we are covering pharmacy management, which is covered in chapter 26 of your pharmacy terminology book. So that's the book that I would suggest that you review as you prepare for this week. Now, in addition to that, I did some research for you, and I'm going to be posting an article that I found from ASHP. ASHP is the Association, the Society, American Society of Hospital Pharmacists, is what that stands for. And so basically what this article that I've found for you does is it talks about some of the requirements of a pharmacy executive. And so when we think of a pharmacy executive, we think of the person who is managing the pharmacy, hence pharmacy management. So, not only is this particular article that I'm going to post give you kind of things like, what are the requirements to be a pharmacy executive and things like that, but it's going to tell you some of the things that a pharmacy executive may or may not do in their role. So, when we think of managing a pharmacy, managing a retail pharmacy versus managing a inpatient hospital pharmacy or even a non-acute care pharmacy, but not retail. Every one of them is going to be a little bit different, but they are going to be a lot of similarities. So some of the things that they all have in common is the people part of it, right? We always have to have some sort of management skills when it comes to the people that we're working with. So they're going to have to work with, basic HR types of things. So making sure that they are, taking care of that piece of it as far as their responsibilities go. So making sure that you have the right amount of staff for the right amount of work, those kinds of things. But in addition to those things, when we think about a pharmacist who is in charge, they've got a lot of other responsibilities as well. So the first thing is what you might think of as strategic planning. So basically, what is going to make it profitable? So what are they going to do to not only improve patient experience, but quality, safety, the patient's access to that, all of those things are what we think of when we think about strategic planning. So it's that whole big business plan idea, okay? So that's ultimately their big responsibility. And then we have medication management. Medication management is all about making sure that patients are getting the right medicine for the right treatment, for the right disease. So one thing that's really talked about a lot right now is what we call antibiotic stewardship. What that basically means is making sure that we're not just pushing antibiotics to be pushing antibiotics. We want to make sure that we are not creating superbugs. We want to make sure that the antibiotics that are being administered are going to be effective for that particular strain of infection, those types of things. The company that I actually work for, we have a pharmacist who actually comes and speaks at least twice a year to all of our hospital pharmacists on antibiotic stewardship. So it's very, very important to make sure that that we're doing what we need to do to make sure that the patients are getting the right kind of treatment. IT stuff. So when we think about medication management and anything else within the pharmacy, we want to make sure that we are keeping up with the technology. So making sure that we are able to support patient care by making sure that the electronic health records are up to date and that we're using the most sophisticated technology to do that. Even things as simple as looking for drug interactions, software that'll take care of those types of things. Those are all things that are part of what a a pharmacy management team or the manager is going to have to be responsible for, making sure that everything that they're using within that facility meets those qualifications and, it is up to snuff, so to speak. Okay. And then quality outcomes. This is especially important in inpatient settings. A lot of the reimbursement nowadays is going to be tied to what we call quality outcomes. So the patient actually has a say in, what happened to their treatment. So they might be going back and providing feedback, or things like readmissions. Maybe a patient wasn't treated properly and they had to be readmitted. All of those things go into evaluating outcomes, and whether or not we had the right type of outcomes will determine how much we get paid. And ultimately, obviously, that's important. So, sorry about that. I am babysitting my grandchildren. So, apparently someone wants grandma. But, the last thing that I want to remind you of when you talk about this is just regulatory and accreditation. Regulatory and accreditation compliance simply means that we want to make sure that we are, hey buddy, just a second, that we are, I know Sissy's awake, thank you. The benefits of working from home. So not only is my grandson awake and his sister, but regulatory and accreditation compliance. We want to make sure that we are meeting all of the guidelines set forth by both the federal and state government. So that's another part of pharmacy management. And last but not least is supply chain. That's actually the field that I work in. I work for a GPO. And so, at least now I do. I've worked in several different settings, but my current job as a pharmacy analyst is in supply chain. I work for a GPO, and so we are there to help the pharmacy management team ensure that they are getting the best price possible. Okay, so it might be for their medications. We might be coming in and doing consulting, looking at things like how can they optimize their spend for employees. All of those types of things are the things that we help them look at. So, like I said, I will have this article on pharmacy management that I will upload so that you can review that in addition to my video. And if you have any problems or questions this week, please make sure that you reach out to me, and have a great week.